Good day, everybody. I just wanted to continue our discussion on patient dignity. The title of this video will be HIPAA and Entitlement. What we're going to start off discussing with is how our current system works. HIPAA on our treatment floors is a joke. Sorry if there's any managers or doctors watching this, but it's a joke. We have patients that are talking to their doctors, to this whole multidisciplinary team of at least 7+ people, most of whom they haven't talked to for probably about a month before, about a lot of their personal health issues. Some of this stuff they're discussing, personal things, diarrhea, erectile dysfunction, heck, social issues, marriage problems. It's a lot of stuff that is very personal, and there's patients on that side and on that side of the patient who are just sitting there with their little eagle ears, just waiting to spread the news to everybody else in the lobby. And because they talk there. They talk there. So, doctor, I've been having a lot of rectal leakage lately, and it's getting kind of crazy, and I feel like it's happening right now. We need to build up a rapport of trust with our patients. The reason why this is important is that if the patients do not tell us things, we cannot help them. I am a very private person. That means I usually don't tell people everything that's going on. Like, there's health issues that I'm not going to discuss with just anybody. I really need to feel like you have a purpose, a reason for me even telling you. And if you're going to go and spread it out to the rooftops, I'm probably not going to tell you. So when we're talking with the patient, if we are, not being trustworthy with our information, if we're shouting out, hey, Mr. So-and-so has hemorrhoids, even worse yet, in a joking manner, that compromises so much of our professional integrity. And that means that patient so-and-so ain't going to tell you shit anymore. They're not going to divulge anything private. They're not going to say anything. So it's very important that us as professionals, we need to cut that out. So what this has to do with you is keeping the patient's dignity with their problems, with their issues, with their concerns. If a patient comes to you with a problem, especially if it's a personal problem, something that you wouldn't want other people knowing if you were the one suffering from it, keep that on the down low. Keep that at the nurse's station. Bring it back. Don't be shouting that stuff across the floor. Don't be, telling so-and-so and then making jokes about it. Just try and keep your things professional, because for us to be able to help these patients, we need to be able to know what's happening with them. As clinicians, we have a really bad level of entitlement that the patients need to tell us every little thing. And if they don't tell us, it's their own fault that something went south. Well, that's not the truth. The truth is, we are part of the reasons why that's not happening. Because if I don't trust you, I'm not going to tell you anything. I'm not going to tell you what happened to me yesterday. I'm not going to tell you this or that. So we need to stop that entitlement crap. We need to earn their trust and their respect to discuss their health. This is something that's vital for us, especially to be professionals in our field, to actually help these patients. They need to be able to come with us about stuff. They need to straight up tell us, hey, I had blood in my stool last night. That's really important stuff, and you guys know that. But if the patients don't trust us, if we don't build that rapport of professionalism, they aren't going to tell us crap. And so that means if the patient has a GI bleed, but nothing happened to prevent it, guess whose fault that is? Ours. So let's be better than that. Let's consider the patient's dignity, especially when it comes to their health and decisions, and be better technicians and better professionals.